Hi, I'm Tiffani Lowell. I am a nurse practitioner with SSM Health. I work in primary care and I also run the bone health program doing osteoporosis treatment, which is what I am here to talk about today. So osteoporosis is a disease that makes the bones weak, making it easy to fracture or break very easily. I've got a couple of stats from the National Osteoporosis Foundation. 1 in 2 women and up to 1 in 4 men aged 50 and older will break a bone due to osteoporosis. A woman's risk of fracture is equal to her combined risk of uterine, ovarian, and breast cancer. A man is more likely to break a bone due to osteoporosis than he is to get prostate cancer. 24% of hip fracture patients age 50 and over die in the year following their fracture. 6 months after a hip fracture, only 15% of patients can walk across a room unaided. Also, 1/4 of hip fracture patients end up in the nursing home after, and half never regain function. So about half of osteoporosis-related repeat fractures can be prevented with the appropriate treatment, which is why it's very important to look into this and make sure you're doing everything you can to keep your bones as healthy as possible. So who is at risk for osteoporosis? Women 65 and older, those who have had a previous fracture, and especially if you've had what we call a fragility fracture, which is one that occurs from a standing height or below. Most common sites for those are the wrist and the spine and the hip. Also, if you take certain medications that can increase your risk of osteoporosis, heparin, seizure medications, if you take steroid long-term or frequent steroids such as prednisone, certain breast cancer treatments, medications for reflux such as Prilosec, Nexium, Protonix, if you take those long-term, those are some of the different medications that can affect your bones. Also, if you have a parent, one of your parents had osteoporosis or a fracture, if you are malnutritious or have a low body weight, if you smoke, that can affect your bones, or if you consume too much alcohol. We consider about 3 alcoholic beverages a day or more as excessive. If you have rheumatoid arthritis or diabetes, if you have low testosterone or went through premature menopause, if you have malabsorption, inflammatory bowel disease, or chronic liver disease. And then also certain races, white and Asian adults are more likely to have osteoporosis than other races. So what you can do to lower your risk, and this goes for anybody, even if you're not in that at-risk category, this video is more tailored to those 50 and older. So calcium and vitamin D are very important. Calcium, if you are a man in between 51 and 70, you need 1,000 milligrams of calcium. If you're 71 and older and a man, or if you're a woman, 51 and older, you need 1,200 milligrams of calcium. And that's not just supplement, that's also through the food. So you can see kind of what foods you eat and what amount of calcium you get on a daily basis from the food, and then whatever you're not getting, then I want you to supplement to equal that 1,200 or that 1,000 milligrams. Foods that are high in calcium: dairy, such as milk, cheese, yogurt, broccoli, green leafy vegetables, almonds, oranges, orange juice, that sort of thing. So say you're getting 600 milligrams in your food, then I want you to supplement with 600 milligrams. If you take, there's a couple different forms of calcium. If you're taking a medicine for heartburn or reflux, something it's an antacid, Prilosec, Nexium, Pepcid, any of those, I recommend taking calcium citrate, because that's going to be better absorbed. And then also, if you have problems with constipation, calcium citrate is also going to be probably better for you, or you're going to be able to, you're not going to have as many problems with it. And then also, breaking that down into 500 to 600 milligram doses at a time is going to be better absorbed than taking that all at once. If you need 1,000 milligrams, if you take it in 500 milligram increments, that's going to be better absorbed. If you're not going to remember to do that, then I would say just go ahead and take it all at once. That's fine too. It's just going to be better absorbed, broken up. And then also checking the label to make sure it's purified. You can check for a USP symbol. That's just to make sure it's a good product. And then vitamin D, between 800 and 1,000 international units of vitamin D is recommended, but actually so many people are deficient in vitamin D, they require higher doses than that. So I do recommend getting your vitamin D level checked to make sure that you don't need a higher dose than that. Getting good exercise is really important for your bones. Weight bearing and muscle strengthening exercises are what we like to focus on. Weight bearing, that would be things such as walking or the elliptical, and then muscle strengthening, that would be, lifting some free weights or some resistance bands, something like that. 30 minutes a day, 3 days a week. If you can do more than that, that's excellent. And it doesn't even have to be 30 minutes at a time. It can be broken up into 5 or 10 minute intervals throughout the day. Just find a route throughout the house if you want to walk through the house, especially on icy days like this. You may want to stay in the house so you don't go out and slip on the ice and fall. And then also, if you smoke, quit smoking and try and avoid drinking too much alcohol and doing what you can to prevent falling. They had here with Healthy Living, they did a fall prevention day last month. I recommend going back and viewing that. But, mainly making sure you don't have rugs in the house you're going to trip on. Make sure you have adequate lighting, handrails where you need them, that sort of thing. So if you're in that category, if you're one of the people at risk, I recommend talking to your PCP. You can also call and schedule an appointment with me at the Bone Health Program. My numbers to call and schedule with me is 405-218-2530. We can get you set up for a bone density scan if you haven't had one, and then follow up with me to see, talk about the health of your bones and if we need to get you on any kind of treatment. And then also, the calcium, vitamin D, and everything we just talked about as well. If you have a result of a bone density scan, you're not sure what those are. I was going to kind of briefly talk about that. The T-score, we give a T-score which is comparing your bones to healthy bones. So if you have a T-score -1 or above, that's normal. If you have -2.5 or below, that's considered osteoporosis. And then if you're in between that range, if you're between -1 and -2.5, that's considered osteopenic. So you've got some bone loss, but not quite in that osteoporosis range. So that's kind of where, gives us an idea of what your health of your bones and if we need to start you on any kind of treatment. Even if you're not in that osteoporotic range based on your T-score, we may still start treatment based on other factors. If you fractured recently, or we will also calculate your fracture risk and see if you have an elevated fracture risk, we most likely will go ahead and start some treatment to help your bones, make them stronger. There's several treatment options. I'm not going to go into great detail on those. There's what we call anti-resorptives, and that helps to maintain the bone you have and slow down the breakdown of the bone. And then there's what we call anabolic agents, and those will help to build the bone. We'll also treat any underlying causes of the osteoporosis, such as testosterone. That's one thing I didn't mention before. If you're low in testosterone, if you're a man, you're low in testosterone, that can contribute to osteoporosis. And then also hyperparathyroidism can contribute to osteoporosis. So kind of treating some of those underlying causes. If you have hyperparathyroidism, maybe, may watch it. You may see a specialist, possibly have surgery to help with your bones as well. So if you have any questions, I know we are planning on doing this video via Facebook Live, and we didn't get a chance to do that. So if you have questions, you can email me at tiffani.lowell@ssmhealth.com. That is TIFFANI Lowell at ssmhealth.com. And then you can also, like I said, you can call and schedule an appointment with me at the Bone Health Program, 218-2530. And I also wanted to mention to any of my existing primary care patients, I'm still going to be seeing you. I'm still seeing you where I have been so I don't want to confuse you and think that I'm seeing you in other locations or that you need to call this other number to schedule an appointment. I'll still see you, still schedule how you always have been to see me out there. I see patients for bone health in Midtown and then also in Midwest City. So if you have any questions, feel free to email or call, and I hope you guys are staying safe.